This conference will now be recorded.
Okay, so good morning, everybody. Is my voice audible?
Yes, sir.
Okay, so we'll continue with the mercury poisoning. So we have seen two poisons, metallic poisonings. One is arsenic, one is lead. Uh, we have known some of the salient features of arsenic. As you know, we have meese lines on the nails. We have hyperkeratosis of the palms and on the soles of the feet, and then we have raindrop type of pigmentation, and then we have garlicky odor. So these are some of the silent features of arsenic poisoning. And then we have known the difference between arsenic poisoning and cholera. Arsenic poisoning is an ideal homicidal poisoning because it mimics a natural disease. It mimics cholera disease, and then if a casualty medical officer can easily miss an arsenic poisoning, and then he can treat for cholera disease rather than treating for arsenic poisoning. So we have known some of the features, how to differentiate between arsenic and cholera poisoning, and then we have learned about lead poisoning. Lead poisoning, the silent features are, we know we have the basophilic stifling, we have the lead line or the Bertollian line. Um, so, and then we have anemia, and then you have pallor of the face, abdominal pain. So you have reproductive changes. Abortion is one of the causes which leads to lead poisoning. So these are some of the salient features of lead poisoning. And then now we will see about the mercury poisoning. Very important. Mercury also. Pink disease has been asked many times in the examination, otherwise called as acrodynia. And then there are some specific entities, specific names pertaining to mercury poisoning, which have been asked in the examination, like mercurial iridism. All these things have been asked in the examination. So mercury poisoning, otherwise called as quicksilver or liquid silver. Previously, we have discussed all these things. Again, we will go through that because some of you may not have because of the problems in the net. So today we will finish this one, and then in the next class we can take iron poisoning. So mercury poisoning is otherwise, mercury is other name is quicksilver or liquid silver. And what are the sources of this poisoning? There are three broad industries or broad specialities through which a poisoning can occur. One is industrial area, then medicine and dentistry, and then miscellaneous regions. In industrial, we know the barometers, the sphygmomanometers, and then thermometers, ceramics, dry cell batteries, explosives, fireworks, and then fluorescent and mercury vapor lamps. So all these things contain mercury column. You know, in thermometers, we commonly use them. We have the mercury column, and then in sphygmomanometers, BP apparatus, we have mercury column. Nowadays, it has been changing to the digital world. Even though the digital world has some about 10 to 15% degree variation, plus or minus can be there in readings. But the best method previously is again the manometer and thermometers. But in order to avoid poisoning with these uh, instruments to the medical faculty. They have been changing into the digital nature. And then medicine and dentistry, antiseptics and disinfectant contains mercury products. Dental amalgam and purgatives also contain the mercury metal. And then miscellaneous uses, electroplating, fiber softener, and then fingerprint powder, very commonly used fingerprint powder, uh, and then gold and silver extraction, pesticides, rodenticides, and fungicides. So these are some of the common areas which use mercury in the synthesis of their manufacturing process. So there are three forms of mercury. One is metallic mercury, inorganic mercury, and then organic mercury. Three forms of mercury: metallic, or otherwise called as elemental. Number two, inorganic. Number three, organic. Metallic or elemental mercury is a silvery liquid which vaporizes at room temperature and gives a toxic vapor known as mercuric mercury. So, so vaporized form of mercury is nothing but mercuric mercury. So metallic or elemental mercury, which is silvery liquid, and it vaporizes at room temperature, which are toxic to the individuals who breathe in, and then that is known as mercuric mercury. Inorganic mercury, which are nothing but salts of mercury chloride, mercuric sulfide, and mercurous chloride. So mercuric chloride, mercuric sulfide, and then mercurous chloride. And then organic mercury, which are more toxic than the rest of the two. They are ethyl, methyl, and phenyl mercury. Ethyl, methyl, phenyl mercury are organic mercury, and then inorganic mercury are salts, where mercuric chloride, mercuric sulfide, and mercurous chloride are there. And then we have metallic elemental mercury, which vaporizes at room temperature, which we known as mercuric mercury. So what happens to this mercury when it is enters the body? So after it can be absorbed in any route. So after inhalation, elemental mercury, it is readily absorbed through the lungs and it enters the bloodstream. So through the alveolar membrane, the vapors can enter, it can be absorbed, and then it will enter into the bloodstream. Through ingestion, through oral route, mercury is absorbed slowly, and then mercury is rapidly converted in the blood to mercuric ions, which leads to renal tubular damage. This is very important. So mercury mostly affects nephrotoxic. Mercury is a nephrotoxic agent, whereas you can see lead is reproductive system toxic. Lead is reproductive system toxic. That's why the males and females will have sterility problem, and then the females will have the problem of abortion. So whereas in case of mercury, it causes nephrotoxic, renal tubular damage. Per se, it is renal tubular necrosis. And then CNS, mercury has a direct toxic effects on both cerebellum, temporal lobe, basal ganglia, and then corpus callosum. Both organic and inorganic mercury can be absorbed through intact skin. So all the forms of modes of absorption is there. It can absorb through intact skin. That's why whenever in hospitals, when there is a break of thermometer and then the mercury flows on the floor, don't try to take it with your hand. Normally the nurse will take whenever there is a breakdown of either BP machine or the thermometer, they try to collect it with their bare hands, which should be avoided because it can be absorbed through skin, through intact skin it can be absorbed. And then whenever the temperatures are high, definitely it will cause fuming. So a person who is collecting the mercury from the floor can easily be poisoned by the vapors that come up, which vaporizes from the mercury metal. So all the three forms of inhalation, ingestion, and then contact absorption is there in mercury. Inhaled elemental mercury poisoning. It occurs while heating metal in a closed room or following a gold refining in a closed area. So it occurs in gold refineries. So what are the symptoms of inhalational mercury poisoning? We have cough, dyspnea, pulmonary edema, and then ARDS, acute respiratory distress syndrome, ARDS. So irritant, it is a irritant respiratory effect. Mercury, because in vaporized state, it causes irritation of the lungs, leading to coughing, dyspnea, edema, pulmonary edema, and then ARDS. So one entity called metal fume disease. Metal fume disease occurs due to mercury vapor poisoning. The symptoms are fever, because it is a fever, metal fume disease. It is a fever, it has pyrexia, cough, malaise, and then we have flu-like symptoms. There can be cold, there can be stuffing of the nose. So all these flu-like symptoms can be there. So that is called as the metal fume disease, metal fume fever, which is there in mercury vapor poisoning. And then the symptoms: pyrexia, cough, malaise, and flu-like symptoms. CNS features are confusion, emotional liability, there can be psychosis, and then convulsions, depressions, and coma can be there. So CNS effects are common, nephrotoxic effects are common in mercury poisoning, and here in vapor poisoning there is more flu-like symptoms which prevail. And then organic mercury poisoning, where there is acute poisoning symptoms will occur. This is due to exposure to pesticides by the farmers or rodenticides by the household people, and then fish contaminated with methyl mercury. Fish contaminated with methyl mercury, and then uh, the symptoms are mostly CNS toxicity prevails in a way there where there is a dysarthria, ataxia, paresthesia, neuropathies, and then there is diminished auditory and visual acuity. There is diminished auditory and visual acuity, dysarthria, there is difficulty in speaking, ataxia, there is difficulty in walking, paresthesia, the person can have tingling and numbness and burning sensation in the feet, the hands. Neuropathies can be there, where there can be radial nerve neuropathy, ulnar nerve neuropathies, or tibial nerve neuropathies can be there, and then diminished auditory and visual acuity changes can be seen. Minimata disease. Minimata disease is caused due to eating of the fish poisoned with mercury. So it is Minimata disease is a type of organic mercurial poisoning due to eating of fish poisoned by mercury. This occurred as a disaster in Japan in 1956 by eating fish contaminated from the Minamata Bay. Minamata Bay is a name of the place in Japan. So Minamata is the name of the place in Japan, and the bay is nothing but a sea type or a ocean type area. So Minamata Bay disease, where the industries used to release the mercury waste products into the sea, and then these waste products are eaten by the fish, and the fish, when they are eaten by the humans, they get infected with this they get poisoning with this organic mercury, causing a disease called as Minamata disease, which where the CNS effects prevail rather than the other symptoms. Whereas in case of vapor disease, metal fume disease, it is like the flu-like symptoms. The respiratory system is affected more than the CNS. So organic mercury poisoning, it occurs mainly due to ingestion. Here, the GI symptoms will prevail. The GI symptoms will prevail where the patient will have, because it is a potent GI irritant, the patient will have mostly erosions. The patient can have esophageal, stomach, small and large intestine erosions. There can be hematemesis, vomiting of the blood can be there because of the erosions. The erosions can lead to blood vessels. Erosions of the mucous membrane can always rupture the blood vessels which are underlying the mucous membranes. It can corrode, erode the mucus, the capillaries, thereby releasing the blood, and then this blood will cause hematemesis and then bloody diarrhea. And then because of the loss of blood, the patient can land into hemorrhagic shock in severe cases. Next, nephrotoxicity. Nephrotoxicity is caused due to mercury ions. We have known that whenever a person consumes mercury products or when he is inhaled mercury vapors, it is absorbed through the alveolar membrane and then they are converted into mercury ions in the blood. And these mercury ions are excreted through the kidney, and then these mercury ions can damage, tubular necrosis can occur in the kidneys and leading to acute renal failure. And then if it is small doses are taken, then slowly it can lead to chronic renal failure in the long-term survival. So inorganic mercury poisoning, two main systems are affected. One is GAT, another is nephrotoxic nature. Nephrotoxicity is due to mercury ions, and per se, in particular, it is due to ATN, acute tubular necrosis, and then gastrointestinal symptoms mostly due to erosions, and then leading to blood loss by hematemesis or bloody diarrhea. Chronic mercury poisoning. Chronic mercury poisoning has been asked many times in the examination as a 4-mark question. Sometimes it can be also asked as a 2-mark question. Otherwise called as hydrorchism. Hydrorchism. So chronic mercury poisoning is also known as hydrorchism. If we know that chronic lead poisoning is known as satanism. Chronic lead poisoning is known as satanism. Chronic mercury poisoning is known as hydrorchism. So what are the etiologies? There is continuous accidental absorption of mercury by the industrial workers. So any chronic poisoning, mostly the industrial workers are affected, mostly in metallic poisons. Then another reason is excessive therapeutic uses. So we have known that it is used in medicines and dental amalgams and then antiseptics, so all these things when they are excessively used, then it can cause poisoning. And then use of pesticides and rodenticides is also one of the reasons. So chronic mercury poisoning, otherwise called as hydrorchism, seen in industrial workers. What are the signs and symptoms of chronic mercury poisoning? One is salivation, inflammation of the gums with the blue line. There is sore throat, loosening of the teeth. You know, inflammation of the gums and blue line we have seen in the lead poisoning. There is a blue line also there in the lead poisoning, which we call it as the lead line or Bartolian line. Bartolian line or lead line we have seen where there is also a blue line at the junction of the gums and with the teeth. Here also there is inflammation of gums with blue line. There is sore throat, loosening of the teeth, GI disturbances, anemia, then chronic inflammation of the kidney. So these are some of the generalized symptoms of chronic mercury poisoning. And the specific symptoms are very, very important. Specific symptoms of chronic mercury poisoning are Danbury tremors, concussio mercurialis, mercurial erythism, Mercurial Lentis, Acrodynia. There are 5 specific symptoms for chronic mercury poisoning: Danbury tremors, concussio mercurialis, mercurial erythism, Mercurial Lentis, and then Acrodynia, otherwise known as pink disease. What are Danbury tremors? Danbury tremors, it starts in the hands as a coarse tremors, and then they progress to the lips and tongue, and then they finally in the arms and legs. So Danbury tremors, they travel from periphery to the central. Periphery to the central. So it starts in the hands, fingers, then it goes to the lips, tongue, and then arms and legs. Tremors is coarse in nature with intermittent jerky movements, which are known as hatter shakes or glass blower shakes. as because it is seen in persons working in glass blowing industries. So Danbury tremors are there. Danbury tremors are coarse tremors which starts in the hands and then which progresses to the lips, tongue, and then arms and legs. And in between these tremors, there are some jerky movements, intermittent jerky movements, which are known as hatter shake or glass blower shake. The name glass blower is given because it is seen in glass blowing industries. Persons working in glass blowing industry. So in advanced form, the sufferers are unable to dress himself, write or walk properly, and that condition is called as concussio mercurialis. So all these terminologies are very important. Danbury tremors, hatter shakes, glass blower shakes, concussio mercurialis. Concussio mercurialis is an advanced stage of tremors where the person is unable. There is the tremor nature is very coarse, where he is unable to button and unbutton his dress, and then he is not able to sign, and the problems can occur in banking system where if a person has to sign on a check, so definitely the bank person can reject because of the changes in the signature name, and then he cannot walk properly. There can be frequent falls because of these violent shakings. So concussio mercurialis, hatter shakes or glass blower shakes, and Danbury tremors. Mercurial erethism. Mercurial erethism is seen in workers in mirror manufacturing firms, workers in mirror industry. It is a psychological changes in the workers due to chronic exposure to the mercury. So more of CNS effects in mercurial erethism, where the patient will have anxiety, depression, abnormal shyness, timidity, irritability, loss of confidence, loss of memory, delusion, hallucination, suicidal melancholy. Melancholy is severe depression, and manic depressive psychosis, and then loss of sleep, insomnia. So these are some of the psychological changes that are seen in workers working in mirror industry due to exposure to the mercury. The symptoms are anxiety, mostly anxiety, depression, confidence, loss of memory, timidity, irritability, and then suicidal nature, delusions, hallucinations, and manic depressive psychosis. Mercurial lentis. Mercurial lentis, as the name suggests, lentis, lens. Lentis means lens. So it is a peculiar eye change due to exposure to vapors of mercury, and it is brownish deposits on the anterior lens capsule. Brownish deposits on the anterior lens capsule, and a slit lamp examination by the ophthalmologist can have this malt brown reflex. Malt brown reflex is there, where there is brownish reflection of the eye due in slit lamp examination, and these brown deposits are seen in the anterior lens capsule bilaterally. So both eyes are affected, and these deposits will not affect the vision of the person. So visual acuity is not affected in mercurial lentis. So some of the mercurial lentis, brownish deposits in the anterior lens capsule. It is both bilateral. Malt brown reflex is seen in slit lamp examination, and no effects on visual acuity. It occurs due to exposure to the vapors, liquid vapors. So mercury vapors. Acrodynia. Acrodynia is other name called as pink disease. It is due to hypersensitivity reaction to the mercury, most particularly in children. So it is due to idiosyncratic hypersensitivity reaction seen in children. Idiosyncratic hypersensitivity reaction seen in children. What are the symptoms? fingers and soles. You can see desquamation is there at the junctions, at the thumb region and the fingers. What is the diagnosis? How to diagnose mercury poisoning? So there are three methods of diagnosis. One is by measuring mercury quantity in the blood, urine, and then by taking an X-ray. So in the blood, if normal range of mercury is less than 3 micrograms per 100 ml, less than 3 micrograms per 100. So all these metals are essential to the body, but if they are then they can be poisonous. So all these metals in elemental form, they are useful for a number of biochemical changes or biochemical reactions. They are very essential. They are minor nutrients. If they are caused normal levels less than 3 micrograms per ml, urine normal levels are less than 10 to 15 micrograms per ml, and then in radiology, X-ray can be we have known that there is a method will produce a very picture on the X-ray. So blood mercury, urine mercury levels, if they then they can be easily diagnosed with mercury poisoning. What is the management? Management as a routine involve further exposure. We can use demulcents, and then saline purgatives can be used, and then chelation therapy, very essential, very useful, and it is specific antidote for metallic poisons where we use ball, DMPS, DMSA, and then D-pentylenamine. Ball, DMPS, DMSA, and D-pentylenamine are the chelating agents that we use in the treatment of mercury. What are the autopsy findings? Autopsy findings can be the grayish mucosa of the stomach can be known. There can be congestion of the viscera and then ulceration of the colon. We know that it is a GI irritant, so it causes erosions of the mucosa. So that's why there can be ulcerations of the colon. There is grayish mucosa of the stomach and then congestion of the viscera. What is the significance of mercury poisoning? It is an important industrial or occupational hazard. And then we know the dry cell batteries, which are very small, found in cameras, torches, and watches, contain about 2 grams of mercury oxide. They can cause accidental poisoning by ingestion in small children. And then WHO is planning to phase out mercury-based medical devices in Asia and Africa, especially the sphygmo manometers, in order to prevent this mercury vapor poisoning or mercury poisoning by contact through the skin. Also, it is prevented. So this is of the things, and then this is some of the I have kept in a table form in order to easily remember some of the salient features of all the three uh, poisons: arsenic poisoning, lead poisoning, and then mercury poisoning. You can see in arsenic poisoning there are specific symptoms. There is hyperpigmentation of the skin, there is hyperkeratosis of the palms and soles, mease lines in the nail, and then wasting, muscle wasting is there. Whereas in case of lead poisoning, we have anemia, facial pallor, lead line in the gums. There is abdominal pain, colicky pain. There is lead encephalopathy and lead palsy. Whereas in case of mercury poisoning, we have Danbury tumors, Compassia mercurialis, mercurial iritism, Mercurial Lentis, and then Acrodynia. Diagnosis in arsenic poisoning is specific symptoms. Symptomatology is very important. And then we can diagnose by 24 hours urine excretion. If it is greater than 100 mg arsenic, then it signifies there is arsenic poisoning. In lead poisoning, we have peripheral blood smear where there is basophilic stiffening, And then we have urine ALA, amino linoleic acid synthase is elevated because it is used in synthesis of hemoglobin. So all these enzymes are elevated. In case of mercury poisoning, there is urine excretion more than 10 to 15 micrograms per 100 ml. Then we can diagnose mercury poisoning. Treatment in arsenic poisoning, we have gastric lavage. In acute poisoning, we have gastric lavage, demulsions, chelation therapy with the ball and penicillamine, whereas not much acute poisoning is seen in lead and mercury. And we have only thing is we have to take the person from the exposed area, then it will be okay for that. No, nothing specific for the lead and mercury. In case of chronic poisoning, arsenic poisoning, we have to give supportive measures and then chelative therapy. In lead poisoning, remove from the exposed area, give chelation therapy with BAL and EDTA. Thiamine can be given for neurological manifestations, and then calcium gluconate for colic abdominal pain. Whereas in case of mercury poisoning, remove the patient from the exposed industrial area, chelation therapy with BAL and DMSA and then penicillamine. You can see that penicillamine is used both in arsenic and mercury, whereas BAL is used in all the three. BAL is used in arsenic poisoning, lead poisoning, and then mercury poisoning. And then DMSA is specific, DMSA and DMPS is specific to mercury, and EDTA is specific to lead poisoning. Autopsy findings in arsenic poisoning, we have red velvety appearance of stomach mucosa in acute poisoning, and then there can be focal hemorrhages and then flea-bitten appearance. Flea-bitten appearance can be seen on the stomach mucosa. Hair, skin, muscle tissues are also preserved along with the routine viscera in case of arsenic poisoning. Lead, the dead body looks anemic because lead poisoning is used. Lead is a poisonous in heme synthesis. That's why the patient will look anemic, emaciated, and the person can lead lines can be seen in the gums. And mercury poisoning, we have erosions and then congestion can be seen in the autopsy findings. So that's all. So in the next class, we'll see iron poisoning. So thank you for your patient listening. You can leave now. So tomorrow in next class, we'll continue with the iron poisoning. Thank you very much.